Just thinking about all the people that have knee pain if they ski or do some sort of winter activity and they have a lot of knee pain, we have a solution for you. Dr. Khan is here from Wasatch Pain Solutions. If you don't want to have surgery, this is an alternative, and you said knees are huge this time of year.
Yeah, with everybody wanting to ski and snowboard and be on the mountain, there's a lot of stress that's being placed on the knee itself just by going through the different motions that you have to go down the mountain. That results in a lot of stress on the knee, the cartilage that's in there, as well as the ACL ligament, which is the big main stabilizer of the knee.
So when we're talking about not having surgery, what is the alternative? What do you do?
So what we do is we harness something called the Regenexx stem cell therapy, which is using your own bone marrow in a patented 3-step process to actually repair the damaged tissue that's going on in the knee.
So how do we do that? How do you take it out? How does it work?
So traditionally, a patient will come in, and when we do the procedure, it's like I said, there's 3 steps, and the first step is a series of injections that would help to bring blood supply to the area, to nourish the area, to actually provide a fertile ground for the cells. Then the second day, we would do the bone marrow extraction from your hip area, and then re-inject that later on in that day. And then the last step is really just a blood platelet injection to kind of keep those cells growing with all the growth factors.
And what do you hear from your patients after you do this?
Our patients do really, really well. So we have a national patient registry database that we base our decisions of how patients should averagely do. And traditionally, around 3 months out, people are doing 50 to 55% better. And interestingly, our outcomes are slightly higher than the national average, which is kind of cool to see. But then that extends out to 6 months and even out to 4 years out, patients are 76% better.
That's amazing. And you said one treatment.
One treatment.
Most people are fine after that.
Correct.
And how long does it take after we would say I had a bad knee and you did this with me with Regenexx? How long would it take for my knee to be better?
Usually the first 2 to 3 months.
That's fast though.
It is.
I mean, it's not having surgery, and recovery time from surgery is longer than that.
Well, yes,
and
that's the
we're
big deal.
talking about meniscus tears, and you said ACL tears as well.
Correct. So we're currently the only clinics, or at least the Regenexx network, that's the only clinics that are certified to actually do non-surgical repair of the ACL, which is amazing because that's really not the norm. Norm is an ACL replacement from a surgeon, which then alters the biomechanics of the knee.
Well, and I asked Dr. Khan, I said, how are your knees? And he said, well, they're not wonderful, but if you have constant pain all the time, that's when you want to come in and see you.
Correct. So periodic pain here and there is maybe okay or normal if you stress the knee. But if it's constant or you're doing a certain activity that you like to do and every time you do it, it hurts, this is the time to kind of start thinking about what might be going on and how do we treat this area so that you can keep doing the things you love to do.
Well, and there are other areas. What other areas can be helped with this? Knee is what we're focusing on today and this month.
Correct. So the knee is the main joint that we treat quite a bit. Shoulders are another joint. Ankles are another joint. Hips are another joint that we treat. Elbows as well. So a lot of people that have tennis elbow or golfer's elbow, we do a really good job on getting them back to where they want to.
I love it, Dr. Khan. I know so many people that would benefit from this right now. Yeah. Wasatch Pain Solutions, where are you located?
We're in South Jordan, just across from Mulligan's.
Okay, fabulous. We'll put all the information on our website. So maybe if you're in pain, do yourself a Christmas favor and go see you, Dr. Khan.
Sounds good.
Thank you so much.
Thank you.
All right, let's check in with Emily.